My mission is for you to own your seat at the table of nurse entrepreneurship, gaining confidence, skills, and freedom to live your life on your own terms. I specialize in working with nurses and other health professionals who want to reduce burnout, pessimism, and compassion fatigue. So you can become a successful entrepreneur to reclaim the love you have for your profession and to create a fulfilling and prosperous life. Join the Nurse Shark Academy at thenurseSharkAcademy.biz and come feel the sun, providing a clear path for business success. Okay, bear with us. We're having a little bit of technical difficulty right here, right now. So I'm just going to go ahead and re-add in the Facebooks. Here we go. As I get in for our technical difficulty here, I just love how they make it so difficult for us. All right. All right. And so now we have our live feed. And I want to thank you for those of you that are joining us on Facebook on our Baxter Professional Services page, and those that are joining us on the Nurse Shark Academy page on Facebook, and our YouTube channel, and our NurseSharkAcademy.biz website. Thank you and welcome. And I'm so glad to be here today. We're going to go ahead and get started. But as I'm going to go ahead and show our promo again, because I just thought it was pretty cool that we got a chance to do that. So I'm going to hit the play button so that everybody gets a chance to enjoy the love and come enjoy the sun. My mission is for you to own your seat at the table of nurse entrepreneurship, gaining confidence, skills, and freedom to live your life on your own terms. I specialize in working with nurses and other health professionals who want to reduce burnout, pessimism, and compassion fatigue. So you can become a successful entrepreneur to reclaim the love you have for your profession and to create a fulfilling and prosperous life. Join the Nurse Shark Academy at thenurseSharkAcademy.biz and come feel the sun, providing a clear path for business success. All right, and so there's our new promo for the Nurse Shark Academy show, and I just wanted to be able to share that with you today. Let's go ahead and get started. Today is January the 17th, 2024, for nursing news that you can use live at 5, and we're going to start with our affirmation. And so our affirmation for today: I am a magnet for money. Prosperity of every kind is drawn to me. I am a magnet for money. Prosperity of every kind is drawn to me. And our next affirmation: I know that I do not have to earn love. I am lovable because I exist. I know that I do not have to earn love. I am lovable because I exist. And these are our affirmations from the Louise Hay 365-day affirmations for 2024. 366, I should say, which is a lovely gift from my coach and mentor, Lori Brown. So thank you, Lori, for sending us this affirmation calendar for this year. All right, so we're going to go ahead and get into the news because there is a lot to cover. As always, there's so much going on in the world, and then we'll get into some announcements that we have. So coming up, for the announcement really quick, is that this coming Saturday, we do have our, so you want to start your own nurse biz, nursing school, CNA school. So if you want to start a CNA school and you're interested about that and you have questions about it, just let us know. You can sign up for that at the NurseSharkAcademy.biz. The how to start a CNA training school, that is going on this Saturday. Sign up for that at the NurseSharkAcademy.biz. Let's go ahead and get into the news. So here's our first story. It's coming from McKnight's Long-Term Care News. And it says data breach leaked info on 40 nursing facilities, provider reports. A data leak over the summer may have given hackers access to health records and personal information for both residents and staff at 40 nursing homes, according to the healthcare services provider whose servers were compromised. The company HMG Healthcare said earlier this month that it first identified the leak in November and traced the data breach incident back to August. Although the exact information stolen is unidentifiable, HMG has taken steps to try and mitigate harm and make sure data was not spread further, as well as increasing their data security protocols, the company said in a letter sent to affected employees and residents. HMG CEO Derek Prince said in a statement, "We sincerely apologize for any inconvenience and concern this incident causes you. HMG will continue to do everything we can to correct this situation and improve our protections for you and others going forward." So this is one of those things that we have to look at when we're looking at sensitive data. And a lot of that is coming from people sending scam emails and text messages and things like that. So be very careful when you are on your company devices. Do not click on any of those emails until you know that it's actually from the person that it was sent. And my practice in Indianapolis, we've had those emails go out periodically, and we get an update from IT saying, "Don't click on this." And one of them actually had supposedly come from our CEO, and it did not. And so, be very careful, because this is how this stuff can get onto your websites and your computers, and it can just wreak havoc on you. And then you have to worry about personal information getting out there, and then possible regulatory issues if you don't let people know or detect it soon enough. So there's a whole lot of things that are going on. So I do want to say that these are the next stories can be quite upsetting. So if you are upset by these things, I'm just going to issue a trigger warning, because we're going to talk about some things that have to do with, unfortunately, the demise of a fellow nurse. So here we go. This is from MedPage Today. Dead nurse found in freezer. Deadly hospital error. Weight loss compounder crashes. Here we are. So this is part of their investigative roundup. So a missing nurse anesthetist Mary Margaret Haxby Jones, has been missing for 9 years. Yes, you heard it, 9 years, until last month, when her corpse was found in a freezer by family members of the new residents at her home, according to the San Diego Union Tribune. She would have been 81. According to police, Haxby Jones' body didn't have any signs of trauma, which can make it more difficult to determine her cause of death. For nearly 20 years, Haxby Jones worked as a nurse anesthetist at Kaiser Permanente Zion Medical Center in Grantville, California. She retired in 1999. Haxby Jones went missing around the time she and her husband resolved some tax troubles in 2015. The Union Tribune also found that the police had been called to the house 20 times since 2013 for reasons such as welfare checks, potential mental health or elder abuse situations, and an overdose. So as more information comes out, I will definitely share that with you. Further in this report, it is reported that a hospital error killed another Black mother. In November, doctors at New York City's Woodhull Hospital performed an emergency C-section on Christine Fields. Hours later, Fields tragically bled to death. And according to the reporting in the New York Times, Fields' family hasn't been given any explanation as to what led to her death. However, the Times obtained a state health department document from December that explicitly said Fields died because of an error made by medical staff. Again, this is reported in MedPage Today, and this is also reported in the New York Times. It says, reportedly, the surgical team performing Fields' C-section did not alert others of complications that arose during the procedure, including a uterine arterial injury. The document doesn't refer to Fields by name, but the details line up with Fields' death, which an anonymous Woodhull staff member confirmed to the Times. Fields' fiance told the Times that Woodhull staff didn't respond quickly to Fields' deteriorating condition, despite him telling them that something was going very wrong. The report concluded that Fields died from a lack of documentation and a lack of communication among medical staff. This is why I often say, please document, communicate. If you think something's happening, raise a red flag, do a dance, whatever you got to do to get somebody's attention. This is another case, unfortunately, of the egregious birth injuries to Black and brown mothers. And this is really sad. This is also the same hospital that Shayasia Simple died in 2020, also during childbirth. In New York City, Black women face much higher risk of maternal death during childbirth, even higher than the national average, and that is unfortunately the same as Indiana. The maternal death rate for African American women is increasingly higher than the national average. And we do a very poor job in the state of Indiana. So this is why I'm highlighting this, because if I can, one, save a life, and two, possibly save a healthcare worker from making a mistake and having to live with that mistake and the consequences of said mistake, I would appreciate being able to do so. All right, in this last article that they reported on came from the Washington Post about a weight loss drug compounder. It says the Washington Post details the downfall of a compounding pharmacy that was turning out copies of popular weight loss drugs. When the FDA put semaglutide on its drug shortage list in 2022, ACA Pharmacy in Nashville was one of the many compounding pharmacies that swept in to produce the GLP-1 agonist. By 2023, ACA had added tirzepatide to its offerings as well. Producing these two drugs increases ACA's daily prescriptions by tenfold, and its profits soared. But within a few months, the whole operation came crashing down. The Post interviewed former ACA staffers and looked through internal records and found several alarming details. ACA had sent patient medications to the wrong addresses, had lost its national accreditation, try to make it smaller, and struggled to maintain sterility. Plus, staffers openly use the weight loss drugs on themselves without prescriptions. Okay, these are all things that you can't do. In October, ACA Pharmacy has closed its doors for good. So these are some things that are happening, and shout out to MedPage Today for keeping us abreast of these things. So there's more to that. Please be sure to check out their page and their offerings to find out more what's happening. But yeah, you can't just start taking this stuff for yourself. Ugh. And my heart goes out to the family of that deceased nurse, and hopes that things will improve and we can do a better job when we conduct these welfare checks. Okay, here we are. So on the good news, Emory Nursing School receives federal grant to prepare nurse anesthetists for services in underserved communities. So this was a press release by Emory University, and I just thought it was great to talk about. So it says Emory University's Nell Hodson Woodruff School of Nursing has received a grant from the U.S. Health Resources and Services Administration, or HRSA, to participate in its nurse anesthetist traineeship program to prepare certified registered nurse anesthetists for service in rural, urban, and tribal underserved communities. The program will provide scholarships for Emory CRNA students to gain clinical experience in diverse and underserved areas in the Southeast. During each year of the 4-year grant, the School of Nursing will provide data to HRSA on how many program participants took jobs in the same areas upon graduation. Approximately 60 Emory CRNA students will participate in the program. So if you're in that area, I just wanted to let you know that it is available. There are several people that are interested in participating in that program. And the CRNA is one of the highest paid specialties for nurses. Okay. This is a story that came out of Axios. And this is something that we probably all are very aware of, but haven't really thought about. But it says health insurance premiums are eating into workers' wages. So I found this kind of interesting when you look at this story where it says that those families, this is according to information from JAMA Network Open, that those families who are in the lower income pay about 29% of the compensation going to healthcare premiums. Those are in the middle income, about 12%, and those in the higher income, about 4%. So it says families with workplace health insurance may have missed out on $125,000 in earnings over the past 3 decades as a result of rising premiums eating into their pay. While employers, rather than workers, typically bear the brunt of the rising health insurance costs, the study is further evidence that the rising premiums are costing workers through wages they would have otherwise received, and it's costing low income employees and people of color the most. Premium growth has long outpaced wage growth, meaning that the health insurance has become a larger and larger part of workers' total compensation as employers pay out more in health benefits. Premiums usually don't vary based on income level, making them a large percentage of total compensation for low income workers who are disproportionately people of color than those who have higher money. So the average workplace health plan last year cost $24,000 for family coverage, with employers covering about 3/4 of the cost. So, $24,000 for someone that makes $250,000 a year may not seem like a lot, but let's say you're making $50,000 a year. That's a lot. And so I think that's where people are missing where that's coming from. It says, although workers most directly feel the impact of their healthcare spending through out of pocket costs, economists have long argued that soaring premiums have suppressed wage growth. In 1988, healthcare premiums on the average accounted for 7.9% of a worker's total compensation, which includes wages and premiums. By 2019, that had increased to an average of 17.7%. And each of the 32 years in the study period, healthcare premiums were a larger percentage of compensation for Black and Hispanic families than for white families with employer insurance. Those disparities have also increased over time, according to the authors. So here's what the bottom line is, what they've concluded. Our results depict the hidden cost of increasing health insurance premiums for the U.S. worker, less opportunity for wage growth, and a heavier burden of health insurance premiums on lower paid workers and on Black and Hispanic workers. So I want you to understand that, because a lot of times we don't think about what it costs to get your health insurance and what does all that mean. And so that's why I wanted to bring that information out to you as we think about what we're going to do going forward and looking at election year coming up. This is a great time for you to talk to some of your state legislators and your federal congressmen to talk about how can we lower the costs for Americans. Okay. Because this brings up this next story, and this came out from U.S. Healthcare from the Guardian in their U.S. Healthcare section. It says, majority of debtors to U.S. hospitals now people with health insurance. Let's go ahead and get into it. So it says, people with health insurance may now represent the majority of debtors American hospitals struggle to collect from, according to medical billing analysts. This marks a sea change from just a few years ago, when people with health insurance represented only about 1 in 10 bills hospitals considered bad debt. According to Colleen Hall, Senior Vice President for Kodiak Solutions, a billing and accounting consulting firm, we always used to consider bad debt, especially bad debt write-offs, from a hospital perspective, those patients that have the ability to pay but don't. Now it's not as if these patients across the board are even able to pay, because out-of-pocket costs, such as an astronomical amount related to what their general income might be. So when you take a look at the out-of-the-pocket costs, which are now soaring, and the fact that carrying the health insurance now is cutting into your wages, you can see where this is becoming a problem. And so it says, although bad debt can be a controversial metric in its own right, those who work in hospital billing industry say it shows how complex healthcare insurance products with large out-of-pocket costs have proliferated. And so Matt, I am going to butcher your name, Zaflarsky, Director of Revenue Cycle Intelligence at Kodiak Solutions, says what we have noticed was a breaking point right at around 2018 to 2019. The trend has since stabilized, but remains at more than half of all the bad debt. In 2018, just 11.1% of hospitals' bad debt came from insured self pay accounts or from patients whose insurance required out of pocket payments. By 2022, the proportion who did or could not pay their bills soared up to 57.6% of all hospitals' bad debt. So I want you to really look further into this story. There's more here if you want to get on the Guardian and support them and to open up for what they have. But there's more to the story when you think about the rising cost of healthcare insurance and the fact that out of pocket fees are now higher than they've ever been. Okay, so this brings us to our next story, which we're going to talk about briefly. And this story is coming out of KFF Health News. And it says, excuse me, one second. It says, sorry, my thing is going crazy. There we go. It says medical mistakes are more likely in women and minorities. Let's go ahead and get into it. KFF News. And somehow, one second, it went into editing. I don't want to edit. For some reason, my file went into editing and I did not ask it to edit. There we go. Whew, all right, we finally got out of that. Now let me open it up again. All right, here we go. KFF News. All right. Apologize for the delay. It says Charity Watkins sensed something was deeply wrong when she experienced exhaustion after her daughter was born. At times, Watkins, 30, had to stop on the stairway to catch her breath. Her obstetrician said postpartum depression likely caused the weakness and fatigue. When Watkins, who is black, complained of a cough, her doctor blamed the flu. About 8 weeks after delivery, Watkins thought she was having a heart attack, and her husband took her to the emergency room. After a 5.5 hour wait in a North Carolina hospital, she returned home to nurse her baby without seeing a doctor. Okay, my first thought is pulmonary embolism, but we'll see what it is. When a physician finally examined Watkins 3 days later, he immediately noticed her legs and stomach were swollen, a sign that her body was retaining fluid. After chest x-ray, the doctor diagnosed her with heart failure, a serious condition in which the heart becomes too weak to adequately pump oxygen-rich blood to organs throughout her body. She spent 2 weeks in intensive care. She said her cardiologist later told her, "We almost lost you." In a study published on January the 8th in JAMA Internal Medicine, researchers found that nearly 1 in 4 hospitalized patients who died or were transferred to intensive care had experienced a diagnostic error. Nearly 18% of misdiagnosed patients were harmed or died. In all, an estimated 795,000 patients a year die or are permanently disabled because of misdiagnosis, according to the study posted in July in the BMJ Quality and Safety periodical. Some patients are at higher risk than others. Women and racial and ethnic minorities are 20 to 30% more likely than white men to experience a misdiagnosis, said Dr. David Newman Toker, a professor of neurology at Johns Hopkins School of Medicine and the lead author of the BMJ study. "That's significant and inexcusable," he said. Researchers called misdiagnosis an urgent public health problem. The study found that the rates of misdiagnosis range from 1.5% of heart attacks to 17.5% of strokes and 22.5% of lung cancers. Weakening of the heart muscle, which led to Watkins' heart failure, is the most common cause of maternal death 1 week to 1 year after delivery, and is more common among Black women. And so this is why I bring these studies out, because I think we need to be aware of them. And as clinicians, this is something that we need to put in our differential. I certainly do not treat these conditions, but it's also something that I want to know about because I have family members that are having babies, and I would definitely want somebody to take a look at those things. So, according to the report, um, it says that the heart failure should have been diagnosed earlier, and then also it says that doctors have told her not to have another baby or she might need a heart transplant, which she says was very devastating. Women and minority patients suffering from heart attacks more likely than others to be discharged without diagnosis or treatment. Black people with depression are more likely than others to be misdiagnosed with schizophrenia. Minorities are less likely than whites to be diagnosed early with dementia, depriving them of opportunities to receive treatments that work best in the early stages of the disease. Misdiagnosis isn't new. Doctors have used autopsy studies to estimate the percentage of patients who died with undiagnosed diseases for more than a century. Although those studies, some show improvement over time, life-threatening mistakes remain all too common despite an array of sophisticated diagnostic tools, said Dr. Hardeep Singh, professor at Baylor College of Medicine, who studies ways to improve diagnosis. He says the vast majority of diagnosis can be made by getting to know the patient's story really well, asking follow-up questions, examining the patient, and ordering basic tests. Singh, who is also a researcher at Houston Michael E. DeBakey VA Medical Center, when talking to people who've been misdiagnosed, he said one of the things we hear over and over is the doctor didn't listen to me. And so that's why I encourage you to have an advocate. If you don't have an advocate of your own and you can't advocate for yourself, see if you can hire a patient advocate. There's great services out there that are just there for that. And this is where it's having those nurses at the bedside are also important because nurses advocate for their patients. And when you have less eyes there to see what's happening, that's how things get missed. And so I would encourage anybody to read this article further, but I wanted to bring that information out. It is a very serious problem and, as stated, a public health threat. This is another story. This is coming out of Colombia, and it says travel nurse speaks out about assault at MU Psychiatric Center, subsequent treatment. This is from KOMU.com. And so it says Danielle Gensinger is a travel psychiatric nurse with 7 years of experience. On December 15th, Gensinger was assaulted by a patient at University Hospital while she was at work and was left with bruising on her head. According to court documents, video camera footage showed the patient running up to Gensinger and grabbing her hair before slamming her head to the floor several times. The patient, identified as Cody Douglas, 38, was later charged with third-degree assault on a special victim. He's being held without bond at the Boone County Jail. Gensinger said, I remember seeing the floor as he was hitting me, and I was just thinking about my daughter because I have a 3-year-old, and I was thinking, I don't want to be here. I just want to be home. Am I going to see her again? The whole thing was 30 seconds, but it felt like 5 minutes. Gensinger is not alone. According to the National Institute of Occupational Safety and Health, 32.2% of nurses per year experience physical assault, and 38.8% of nurses face non-physical violence like threats, sexual harassment, and verbal abuse. According to Gensinger, there were several failures at University Hospital that might have contributed to her assault. And looking back and talking to some coworkers, this had sort of been the patient's MO, Gensinger said. This wasn't the first time he had been menacing, staring at staff, and having to be redirected from the nurse's station. So finding that out after the fact is frustrating to me because I feel like it could have been avoided had he been properly medicated. She acknowledged she's not a doctor and she can't prescribe medication, but she said with her years of experience, she's been able to recognize that some medications work better than others. She says, I feel like a number of these incidents that you read about or hear about that I talk to people about can definitely be avoided had the patient's been properly medicated. So that, to me, is a failure in the system. Gensinger also said the team nursing approach utilized in the Missouri Psychiatric Center, where nurses are rotated regularly across units within the ward, prevents her from forming meaningful connections with her patients. She says, you don't know these patients. You don't know them like you would if you had a set team of patients that you've been following for the day. When Jensinger returned from her scheduled winter vacation, which occurred after the assault, she said she was not put back on the schedule despite that she was cleared for work after January 2nd. She said that she was told this because of her required medical accommodation post-assault. However, she maintains that the accommodations, frequent breaks every 4 hours, patient must remain seated at work, and no strenuous pushing or pulling of objects would have no impact on her job performance. She says, I pretty much have a desk job for the most part. The accommodations are not telling me I can't go on the floor. It's not telling me not to interact with patients. It's just telling me no strenuous pushing or pulling. And the university hospital is saying they can't accommodate that, and I don't understand it. Jensinger said she's been left in a very difficult situation. While she and her husband had budgeted for a 2-week vacation, she was not prepared to go longer than that without pay. I'm not getting any of my per diem. I'm not getting paid stipends of any kind, and I'm not able to provide for my family because they're not allowing me to return to my job. And so I'm in limbo, stuck talking to my recruiter to try and figure out what's going on because the hospital didn't also verbalize or put into any kinds of words that they are canceling my contract. So technically, I'm still under contract, but I'm not able to work. So what am I supposed to do? That is sad. So first of all, yes, I don't understand if what she's saying is true. Why are you switching patient assignments on the same day? And because she's a traveler, did no one advise her, this is where that communication comes in, that this patient was particularly a risk? So in an email, MU Healthcare provided the following response. Safety is a top priority at MU Healthcare. When incidents such as the one you describe occur, we offer treatment and support and follow our established protocols. It is important to note that the travel nurse identified is not an MU Healthcare employee. MU Healthcare contracts with a managed service provider to set up agreements with external agencies that provide travel nurses to staff 235 hard-to-fill nursing positions at MU Healthcare. So because she's not a regular employee, they're just kind of like, you're on your own there, which is a really sad case. And so I bring it up for you who are traveling, travel nurses. You might want to consider looking at that contract carefully, because if you get injured on the job, would that leave you out of being able to complete that contract, and maybe they won't bring you back? But that's kind of a terrible thing to do to her. So this is another interesting case, and I don't know what you all have to say about this one, but I'm kind of curious because this one's talking about a nursing home resident charged after allegedly kissing another. And I've been in long-term care for a long time, and I've certainly seen some stuff, people just doing whatever they want to do, right? So this is coming out of Waukesha County News, gmtoday.com, and I just found this story, and I don't know, I kind of feel a couple of ways about it, and I'm going to tell you why. Okay, so it says, a 62-year-old man living at Pewaukee Nursing Home has been charged after he allegedly kissed another resident at the facility last month. So John Jarugi, I'm hoping I'm saying that right, was charged Tuesday in Waukesha County City Circuit Court with a misdemeanor count of 4th-degree sexual assault in order to appear in court on February 1st. A criminal complaint did not identify the facility by name, but gave an address linked to the Crosswords Care Center. It said at least one staff member at the care center, which the Freeman determined to be the Crossword Care Center, saw the incident on December 4th, saying that she observed Jarugi touching the woman near her crotch and kiss her on the lips. The woman, recovering from a stroke, is all but unable to speak except for answering yes or no questions, the complaint said. But staff members were able to help a sheriff's deputy interview the woman, during which she indicated Jarugi kissed her on the lips without her consent. The woman indicated there was a prior incident between the two, But staff reported that was consensual and it was not reported to law enforcement, the complaint said. A staff member who saw the incident immediately separated the two, then talked to the woman about it. When asked if she wanted to be kissed, the woman replied, "No, boy," the complaint said. Jarugi told police he walked past the woman in the hallway, called her over, and snuck a kiss, the complaint said. He said he believed she wanted to be kissed, but was upset because she didn't want people to see it occur. He denied touching the woman near her crotch. Jarugi said he kissed her about a year ago to lift her spirits because she had no speech. He said he understood what she was saying when she waved her hands, but could not explain how, the complaint said. When asked to explain why he kissed the woman, he believed it was because they are friends, the complaint said. Jarugi said he believed the woman was not upset at the contact because afterwards she put a finger to her mouth and said, "Shh, shh, shh," the complaint added. So again, I don't know if he's confused or if he's just a predator. I don't know, because I'm like, this is why I don't know. The woman can't consent because she can't talk, right? I mean, she can communicate, but she didn't instigate. She didn't say she wanted this. I mean, dude just walked up and kissed her and I guess kind of groped her, according to the reports. But then that makes me wonder, I'm like, is he all together? Got it together? Because he was saying, well, she wanted to be kissed. Well, how do you know? And then he said she just didn't want people to know about it. Are you sure? So that makes me wonder. I don't know all the details on this case, but let me know what you think about it, because I've certainly seen where it's very much consensual. They both agreed to it. We've had that happen before. They ask for private time. We give it. It's care plan. Families are notified. Hey, they're boyfriend and girlfriend now. They got the right to have, everybody has a right for their sexuality. We understand that. But I'm not sure in this case, because I don't have all the details for one. But this makes me think about it. And I'm like, so what do you guys think about this? Okay. Here's our next story. This is coming from AONL, American Organization for Nursing Leadership. This is a study that just put out with the American Hospital Association. And the survey that they put out asked questions like, what are your organization's current top 3 challenges? And this is interesting from a hospital's perspective. Number 1, staff recruitment and retention is 69%. No big surprise there. Interesting, what they said was number 2, emotional health and well-being of staff, 45%. Number 3, financial resource availability, 34%. And then here on theirs, 4th was workplace violence, bullying, and incivility at 24%. So I find that quite interesting that these were their challenges. Down there was surge staffing, training, etc. Down at the very bottom, maintaining the standards of care, that was sort of in the middle. Travelers contingent workforce, that's kind of down towards the middle. But those are the top 4. And this is something that we've been seeing that's been coming across the board. So that's part of the study that they did. They said, so as a nurse leader, how effectively do you feel you've been able to address these challenges? So they looked at adopting new technologies and innovation. It's at 3.3 on a scale of 1 to 5. Communicating, implementing, changing policies, again, 3.3. Emotional health and well-being of the staff, 3.2. Financial resource availability, 2.7. Health equity, social determinants of health, 3. And maintaining standards of care, 3.3. So you can see that. And then, of course, staff recruitment and retention at 3.1. Workforce violence, bullying, and civility, 2.9. So it says in the past year, they asked questions like, have you witnessed 1 or more incidents of bullying at work? 68% of those surveyed said yes. 31% said no, 1% didn't answer. And then it says, have you witnessed one or more incidents of violence at work? 53% of the nurse leaders surveyed said yes. 45% said no, 1% did not answer. In the past year, have you witnessed one or more incidents of incivility at work? 77% of the nurse leaders responded with yes. 22% no, 1% didn't answer. In the past year, have you witnessed one or more incident of intimidation at work? 72% of the nurse leaders responded yes, 28% responded no, and 1% preferred not to answer. When asked where the acts of bullying or incivility have come, 58% said patient families. 57% said staff nurses. 54% patients. 47% physicians. 30% managers and supervisors, and it goes on down from there. It says, from whom have the acts of violence or intimidation come? 74% from patients, 68% from patients' families, 36% from physicians, 35% from staff nurses, and then public managers, supervisors, etc., faculty all go down from there. So this is an interesting study. I want you to take a look at this. This shows that we have some work to do. But I'm really surprised and not surprised about that high number of physicians with the incidents of violence. Not surprised. I'm surprised that it's still happening, but I'm not surprised that it happened, if that makes sense. And I'll give you an example. Working in the ER as a nursing student, I witnessed a physician have a complete meltdown in the nurses station. I mean, like throwing things, cursing, just being a total jerk. To the point, I didn't know he was the physician. I thought he was a patient. And so I said, hey, are you guys going to let this guy act like this? Shouldn't you all be calling security? Shouldn't he be medicated? I had no idea he was the doctor. So, of course, the nurses said, hey, doc, our nursing student thinks that security should come and we should medicate you. He straightened up for the rest of the shift. I hope that helped him think about how he was acting, because it was very unprofessional and quite juvenile. It's like a 3-year-old having a temper tantrum is what I would describe it. It was just horrible, but worse because of the foul language he was using. But anyway, I say that, and that's why I said I'm surprised that this is still happening, but I'm not surprised that it happened. All right, so let's get into this. Yeah, there's a couple of the stories we have to get into. It's a heavy news day today, but I can't let this stuff go by. I cannot let this stuff go by. We have to report this stuff. Okay, so this came from the Akron Beacon Journal. So we're talking about Akron, Ohio, and it says Hatco, a new healthcare venture capital firm to acquire Summa Health in Akron. Summa Health is trying something radical to secure its long-term future serving Greater Akron. Summit County's largest employer and hospital system has agreed to become a guinea pig of sorts for a new venture capital company aimed at transforming healthcare through technology. Summa and Health Assurance Transformation Corporation, or HATCO, today announced signing a non-binding letter of intent outlining HATCO's planned acquisition of Summa. The deal, which could be wrapped up by midsummer, would maintain or grow Summa's staffing and also cement its headquarters in Akron, neither of which was part of any other proposed summer mergers or sales, said Dr. Cliff Devaney, Summa's president and CEO. Summa, which includes Akron City Hospital, the Barberton campus, Summa Care Insurance Company, and outpatient locations and physician offices across the region has more than 8,000 employees. If the sales go through, Summa would become a for profit hospital, shedding its non-profit status. Proceeds from the sale would go into a substantial community endowment. Divany wouldn't speculate how much money might be involved, but said it would be comparable to the GAR Foundation, which awards more than $7 million annually to Greater Akron nonprofits. So remember we talked previously about private nonprofit health entities being taken over by private equity firms. This is a case that's happening again. So this is something we're going to have to watch what's going to happen in Akron, because as been shown by recent research studies, that for-profit institutions don't do as good a job in maintaining the staffing ratios, keeping the nurses on board, patient outcomes are poor. This is stuff we've reported from previous reports. So I am not saying that HATCO is going to fall into that, but let's see what happens. It says HATCO is a new company owned by General Catalyst, one of the largest venture capital firms in the U.S. And my question is, why are venture capital firms investing in healthcare in this way? We need to think about this. In recent years, it raised hundreds of millions of dollars to focus on healthcare. Dr. Mark Harrison, a former Cleveland Clinic executive and pediatric emergency care physician, joined General Catalyst to launch and lead HATCO in October. At the time, Harrison co-authored a blog post outlining HATCO's 3 goals: working on transformation at about 20 health systems HATCO partners with but does not own, building a model of technology solutions to drive the transformation, and acquiring and operating a health system for the long term where we can demonstrate the blueprint of this transformation for the rest of the industry. So we'll see what happens, and we'll keep an eye on that. And then this is what they're saying, because we remember reported there's other systems that this has happened. And yeah. So we'll see what happens as it goes on. Keep an eye on that. All right, let's get into our next story. It says, why immigrant CNAs are crucial as the nursing home space faces a staffing mandate, quality measures from Skilled Nursing News. It says, given that nursing homes increase their reliance on immigrant certified nursing assistants or CNAs with positive outcomes for care quality during the pandemic, researchers in the space are reiterating the need for a policy change to get more immigrant CNAs into skilled nursing. The most effective policy solution that could help nursing homes get more immigrant CNAs is by creating a new visa category for foreign direct care workers, said Hank Young Kate June with Harvard University. With an increasing number of aging U.S. residents, creating pathways for foreign-born CNAs and fast-tracking visas by issuing them through an opening up of different visa categories may help address the dire shortage and provide legal opportunities for immigrants seeking entrance to this country. The study measured the impact of immigrant nurses on antipsychotic use, fall risk, weight loss, and pressure ulcers, with favorable results in all categories. Moreover, the researchers also noted that the staying power of foreign-born CNAs relative to the native-born ones. Increasing the numbers of immigrant CNAs is likely to improve the stability of the direct care workforce, researchers concluded. So now we're looking at siphoning off direct care workers from other countries to fill our needs again, as we've seen in the nursing shortage that has been ongoing. So it's going to be interesting to see how this works out. And with state laws, how would this work out? Because you would have to train them according to state law, and the way the federal law is that they would have to take some sort of testing to become CNAs in the U.S. So we'll see what happens. But there's more to the story. Please go ahead and read into it. I don't have time to get into it today, but this makes me think about that. And the interesting thing is that um, because they come from, and what's happening in nursing, because they've come from other countries, their visas are often tied to working for a specific institution. And if they should leave that institution, they may lose their visa. So, and then they're tied to these contracts that make them have to pay these exorbitant fees to get out of them. So this is something we'll have to see what's happening in long-term care. Not saying that it will, but given the way healthcare is, it's probably going to take a page from the book of these other actors. So we'll see what happens. Okay, this is a story that's coming out of New Jersey, I believe. Yes, New Jersey. Um, this is from NewJersey.com. And it says they abruptly evicted residents from nursing home. Now they are barred from operating other facilities. The former owner of the Princeton Care Center, the nursing home that ran out of cash and evicted residents in one day in September, must give up her stake in two other facilities or risk forfeiting millions of dollars in federal funding needed to keep those sites open. Gail Bonnier must sell her minority share in the Fountain View Care Center in Lakewood and Tallwoods Care Center in Bayville by no later than March 28th, or those facilities will lose Medicaid funding necessary to keep them open, said acting state comptroller Kevin Walsh. The Bonniers, and I hope I'm, or Bogners, recklessness, neglect, and incredibly poor judgment caused serious harm and trauma to the residents of Princeton Care Center. It presents too serious of a risk to allow them to have influence over any other Medicaid-funded nursing home, said Walsh, according to Bogner's son, the Princeton Care Center's former administrator, Ezra Bogner, in his announcement. So, yeah, just to let you know what's happening. We're seeing more and more closures and what's happening, and we're going to follow that story to see where it leads us. All right. So I have two stories. One that affects us right here at home in Indiana. So I do want to lead with that one. And then our last story. And these are two nurses who made a difference. And so I always like to give a shout out to our Indiana nurses and two nurses in general who have made a difference and are no longer with us. So Indiana nurse among 4 dead after Arizona hot air balloon crash, says she was a beautiful person. This is coming from Fox News. Coming from people.com, sorry. 4 people died and 1 person was in critical condition after a hot air balloon crash over the weekend in Eloy, Arizona, authorities said. There were 13 people on board the balloon at the time of Sunday's crash, the Eloy Police Department said in an updated statement on Monday. This includes 8 skydivers, 4 passengers, and the pilot. It's important to clarify that the skydiving was intentional and was successfully completed by all skydivers before any issues with the hot air balloon were evident. That's when something catastrophic happened and the balloon crashed to the ground. According to the ABC affiliate KNXV, witnesses say that the balloon went up and down prior to making impact. Police have identified the 4 victims who died as Chayton Weisschulich, 28, of Union City, Michigan, Caitlin Bartram of Andrews, Indiana, Adahan Kilcolte, 24, of Cupertino, California, and the pilot Cornelius Van der Walt, 37, of Eloy, Arizona. As of Monday, Valerie Stutterheim, 23, of Scottsdale, Arizona, was listed as being in critical condition. The Eloy Police Department said it is working with the National Transportation Safety Board and the Federal Aviation Administration in investigating the crash. Caitlin Bartram's mom spoke to KNXV about her daughter, a registered nurse with Lutheran Health Network. She says it's kind of somber here at home. We're crying about her on and off and talking about her on and off, so we're trying to make it real. She's a beautiful person. She recently became an RN and was making it on her own. Bartram worked at the Fort Wayne Lutheran Hospital on the advanced cardiac therapy floor. In a statement obtained by People Hospital spokesperson Joy Losi said Bartram began as a patient care technician and graduated from nursing school within the last year. So that's really sad. There has been a fund set up for Bartram's family to cover the funeral and medical expenses. So if you'll go head over to people.com, you can certainly get that information there should you wish to contribute. And so our next nurse making a difference is Dr. Claire Fagan, the first woman to lead any Ivy League institution and former president and dean of the University of Pennsylvania, who has died at the age of 97, according to CBS Philadelphia. Fagan took over as interim president at Penn in 1993 after the departure of the late Sheldon Hackney, who had been appointed by President Bill Clinton to lead the National Endowment for the Humanities. Hackney's tenure ended with multiple controversies related to free speech on campus. The university's interim president, Larry Jamieson, acknowledged in a letter that Fagan led during a challenging time. Fagan also very much served the role of healer, seeking broad community input and implementing many of the recommendations that inform our policies for open expression, respect, and civil discourse today, Jameson wrote. She led Penn's nursing school from 1977 to 1992, and after her stint as president, continued teaching nursing until retiring in 1996. Fagan earned several honorary degrees over her career, served as an expert panelist for the World Health Organization, and was named to the American Nursing Association's Hall of Fame. Her doctoral dissertation focused on children recovering in hospitals when their parents stay over, which the ANA says helped change the rules about when parents can visit pediatric facilities. Dr. Fagan's impact is both her individual accomplishment and the achievement of thousands of nurses. She has advanced by setting high standards, breaking barriers, eloquently speaking for nursing, and promoting the careers of nurse leaders, the ANA said, noting the nursing school rose to number 1 on the U.S. News and World Report rankings by the end of her tenure as dean. The school is still in the top 3 today. Jameson said, perhaps most importantly, Dr. Fagan will be remembered for her impact on the people of Penn, her mentorship, role modeling, and her ability to bridge divides. She was admired, respected, and revered by all who knew her. Fagan is memorialized at Penn with a chair in the nursing department, an award for research, a scholarship, and the building Claire M. Fagan Hall, used by nursing school on the University City campus. Penn is planning a celebration of Fagan's life in the spring. So I just wanted to say that she is our nurse making a difference, and that is our last story for today. Thank you for tuning in. We're going a little over the time, but there was some important news, and I definitely wanted to be able to go over some of this information with you. All right, don't forget that we have our events coming up. I wanted to quickly go over some of those things because always important. So coming up for January the 20th, this Saturday, is our How to Start a Nursing Assistant School workshop. There's still time for you to become a part of that. So go ahead and sign up for that at the nurserockacademy.biz. And next week on Wednesday, we have our BLS renewal class for CPR. So those of you that need renewal for your CPR, our January class is on the 24th. Go to Baxter Professional Services healtheducation.com and sign up for that there. Also, we have our local Alignable event. So our local Anderson Alignable Alliance will be meeting at Jack Rabbit Coffee at 12 noon on Wednesday, January 24th. Bring your business cards. Come on, we're going to be able to share with one another and get some coffee and get warm in this cold weather. So that's all coming up next week. And then we'll be having our next Nurse Rock Academy show episode will be coming out soon. So stay tuned for that. And that brings us to the end of our month. So those are our major events that we have coming up. If you have a community event and you want to promote that on the show, let me know. Please don't forget to like and subscribe and also to sign up, ring the notification bell for those of you that are new on YouTube for when our next show comes out, and share our content and invite people to hear about what's happening in the healthcare news, particularly those that are in the healthcare area, but also to us as regular citizens. We need to do this. We need to find out what's happening in healthcare so that we can be better informed and make better decisions. All right, that's it for me. Bye bye for now. I will see you next week if the Lord wills.